The majority of our calls that come into our office are families expressing their concern for the loved one who has a mental disorder. It is extremely rare that it is only a mental disorder. In fact, most of the interventions we do with people who were believed to have a primary mental disorder get to treatment, and it turns out that they didn't. And the reason I say that is because substance use disorder causes and mimics mental disorder symptoms. And for those watching this who will challenge my comments and say, well, they were diagnosed long before, it doesn't mean that the diagnosis was accurate. Now, let me explain. When somebody is in active addiction or has active addiction mindset or brain before they even start using, the way that they cope and deal with things actually produces mental disorder symptoms. Most of the time, mental disorder symptoms and drug-induced psychosis or alcohol-induced psychosis symptoms, and the behaviors even before those, are brought on by trauma. They're brought on by human suffering. They're brought on by thoughts and perceptions, experiences, and horrifications. They're brought on for reasons that may even be unknown. And then we act out, or people, I should say, act out. And then they go to doctors and they go to psychiatrists, and without any sit down and in a very quick time frame, they're diagnosed with a mental disorder. They're diagnosed with mental disorders in hospitals and in crisis units. They do so in times of stress and anxiety. Very few of our clients are diagnosed for mental disorders professionally and appropriately. You know, on this website page that you're watching this video, I have quotes from textbooks, and it specifically says that when substance use is present, the clinician should assume that the impairments and or the behaviors are a result of the drug or alcohol use until proven otherwise. My point is, it is impossible for any clinician anywhere, doctor, psychiatrist, therapist, counselor, etc., to diagnose a mental disorder when substance use is present, even in times of early incarceration and detox. It takes the brain far too long to come down from drug-induced psychosis to make early diagnosis. And again, for all of you watching this where they were diagnosed early on, it still doesn't mean it was appropriately diagnosed. Because rather than just drug people and label them and give them a diagnosis that carries them through life, when are we going to start helping people address their thoughts and feelings and perceptions and where they're at in their minds? What's bothering them? There are mental disorders that are real, I completely understand, but when substance use is present, it is not accurate. And then I think about, drugs like methamphetamines or even marijuana that's legally purchased through dispensaries where the THC content is off the charts. The drug-induced psychosis that we're seeing is unparalleled to anything we've ever seen. And what we're seeing is schizophrenic symptoms, mania symptoms, deep depression symptoms, talking to yourself, anger, and in the list of symptoms that people go to doctors for, and they're just, bipolar or anxiety disorders. Guys, it is not your job or even ours to diagnose a mental disorder at the intervention. Our job is to address your family enabling, codependency, and family system, and your anxiety and your fears, and to address your loved one's resistance to treatment, because regardless of the diagnosis, you called about their behaviors. So even if you called with somebody with a mental disorder, somebody who's an alcoholic, or somebody who's addicted to drugs, everything we're telling you goes back to you called because of their behaviors. Because if we went through all of this and they got the treatment and their diagnosis or their drug screen was nothing that you even thought existed or was possible, would it change why you did this or how they were acting that caused you to call me? And the answer is a hard no. You have to start addressing the behaviors and the resistance to treatment and why they're not advocating for their own care and how your family's playing a part in that. Enough of the diagnosis. If somebody shoots you, who cares what gun they use? You have a hole in you. You need medical attention. You worry about that later and let the police sort it out. Your loved one's behaviors have you watching this video. Your behaviors have you watching this video. The diagnosis is for another date. That's between your loved one and their clinical team after they're detoxed, and after they're stabilized and brought to baseline. And then, and only then, can we diagnose disorders.